There we go. Good morning, everyone. Pretty good turnout to talk about eyes. I've already had a few people say, is this only about cataracts? And I'm like, well, yes and no. It's National Cataract Month. August is National Cataract Month. Curana puts together these presentations for us. So their presentation is geared towards cataracts, but you guys know me. I'm a talker, and I get off on a little tangent about things. So I'll stop at each bullet point and sort of make a comment. Yes? Next week. All right. And I know many of you have maybe already had one or both done. And if you have, you're exactly right. This may not be the topic for you because you've already been there and done that and you've graduated from it and you're never going to have to go through that again. On the other hand, some of you maybe have not developed any eye problems or cataract issues. And so we will talk about what to look for and things to do to monitor your eyes. For those of you who may have just come in, there are 10x magnifying glasses, pocket-sized, up here on the table, and we have some more colorful and bright sunglasses. Even if you don't really like sunglasses, they're great for dressing up at Halloween or 4th of July. You know, St. Patrick's Day, there's some green ones up here, and you're going to wish you had a pair of green sunglasses come St. Patrick's Day next year. So you guys help yourself. Feel free to come up at the end and grab something. But let's get started. This is a short presentation also. I know that you all are used to me talking for a full 45 minutes, sometimes close to an hour. And thankfully, there's not a lot to say about cataracts. So I'm not going to keep you here all day. But what are cataracts? How many of you, if you don't mind sharing, would you raise your hand if you've already had a cataract or cataract surgery? Okay, put your hands down. Okay, if you have not had cataract surgery, raise your hand. 3, 4, 5, 6. What's that? Everybody else can go home. You guys are already pros about all this. Actually, I'll call on you to answer the questions at the end of the presentation. But what are cataracts? Cataracts are a cloudy area in the lens of our eye. So the eye is very unique organ. If you've never looked at it, you know, we have a clear coating, we have a color of our eye, we have our pupil, we have our lens, we have fluid in our eye, and then lots of blood vessels that go to the eye. So there are definitely a number of problems that can happen with the eyes, and especially as we age. Why is that? Well, because as we age, everything else is aging. Our eyes are aging, our organs are aging. Why do we get kidney disease? Why do we have heart disease? And sometimes I like to say, well, it's a blessing of getting older, you know. The alternative is not getting older, but as we get older, you know, our kidneys have been working for a number of years. Our eyes have been working for a long time. So the lens of the eye is supposed to be clear. It should be nice and clear, and that's what helps you focus light. So when you're looking at something, you know, sometimes we have to turn up the lights to see better, turn down the lights depending on what we're looking at. So it helps us to focus the light. Cataracts are very common. More than half of Americans who are age 80 or older have had cataract surgery to replace the lens. What they do is they remove the lens and replace it with a new one. And I would say in this group, we've already proven, I didn't do a head count, but we've already proven that more than half of you have already had cataract surgery. Interestingly, I thought this was interesting, the average age for age-related cataracts is 40 to 50. Well, I'm on that upper end of that, and there's been sometimes I have told my eye doctor, I'm kind of ready for a cataract. And she's like, why? Well, I wear contact lenses. And then you guys see my readers. And so if you ever come see me in the clinic, I'm constantly off, on, off, on, off, on throughout the whole visit, trying to see my computer, but then trying to look at your skin or looking in your ears. I have to put my readers on to look in your ears. So the good thing about cataract replacement is that it usually clears up your refractive problems. So I'm not wishing it upon myself, but I'm kind of ready for the day that I'm not putting my readers off and on and having to wear contact lenses to see distance. So cause of cataracts can be a number of things. One thing that I noticed was not necessarily mentioned in this presentation is medications. There are some medications that can contribute to cataracts. For women, one of those known medications is tamoxifen. So tamoxifen, if you ever had to take that for breast cancer treatment or breast cancer prevention, it has a known side effect of clouding the lenses of your eyes. And so some people go, well, maybe that's why I developed them. And I would like to say that when I worked in oncology with breast cancer patients and we were using tamoxifen regularly to treat our patients, we would see cataracts in younger individuals. So I would see them more often in their 40s and 50s developing cataracts. But typically it is a later in life type of development. So for the most part, we develop them as we age, or if there's an injury to the tissue of the eye, then you can develop a cataract. Proteins and fibers in the lens start to break down. You all have probably heard me talk at other presentations or in your visit when you come see me in the clinic about the importance of protein. Protein is a building block of so much for our body. Protein is what helps build our muscle. So we do want strong muscles as we age. We don't want to lose our muscle mass. We want to build our muscles and make them stronger. And so proteins are found in the lens of the eye. So that is something for those 3 of you who have not had cataract surgery yet. Make sure you're getting plenty of protein in your diet because that's going to help with those lenses. There are some genetic and just environmental factors that come into play when we're talking about cataracts. And oftentimes, those are the people who generally develop them much earlier in life. But symptoms of cataracts, we can always do a show of hands for this. How many of you had vision changes that you could definitely notice? Yeah, and you said, something's not right. I've got to go get my eyes checked. And usually your optometrist or your ophthalmologist is the one who then says, it's time. Later in this presentation, you'll see that there's no exact time to get it done, but once you know that you have a cataract, you don't have to wait. You don't have to wait for a certain period of time. You don't have to wait a year. You don't have to wait 2 years. You don't have to wait till your vision is failing so bad, that you then get it done. At any point when that cataract starts to develop, they can go ahead and schedule you for that procedure. But some of the symptoms of cataracts is double vision. So when you're looking and you see 2 of everything, that's not normal. If you have to turn on the brighter lights to read or to see things, then that can be an indication of cataracts. Difficulty seeing at night, and especially one of those could be driving. So definitely that could be an indication that you're developing cataracts. Also, sensitivity to bright sunlight, headlamps, lights, lamps. My family, we are all blue-eyed or green-eyed and fair-skinned individuals. And if you've never seen our family pictures or Easter Sunday after lunch, normally we're all doing this. We're outside, and we can't get a good family picture because we're all squinting. So we're very sensitive to sunlight. But this is for, if let's say you've never been sensitive to sunlight. Maybe you have darker eyes and you've been able to go outside and not suffer with needing to wear sunglasses, but then suddenly you start developing a sensitivity to the light, then that may be an indication that you're developing a cataract. Vision that seems filmy or blurry or cloudy, that's also going to be a symptom of a cataract. Changes in the way you see colors Is anyone in here colorblind? No? Yeah, okay, so that's less common. I was expecting to at least see a couple of hands in here, but changes in the way that you see colors. If you know that that tablecloth is blue, but you start looking at it and saying, you know, it looks more purple, or it's looking more green these days, then maybe those color changes are an indication that you're developing cataracts. Seeing a glare, including like a halo around things, or streaks that form around lights, that can be an indication of cataracts. And then, of course, just your vision changing, you needing to change your prescription, feeling like you can't see far away as well. Nearsightedness, it's always the opposite of what you think it is. Nearsightedness means you can't see far away. Farsightedness is you can't see up close. What does it mean when you're both? That means you're Lori and you have to wear, you know, your contacts for distance and your readers for up close. How are cataracts diagnosed? Well, mostly by ophthalmologists and optometrists, not usually by your primary care physician, although we can. We have this type of light to look in the eyes, but the ophthalmologist and optometrist, you know, they wheel in or slide over this big mechanism right in front of you where they're taking a deep dive, a deeper look into your eyes than what we can do with our ophthalmoscope. So a comprehensive exam. So if you're not getting eye exams, for the 3 of you in the room with no cataracts, then once a year you should be getting an eye exam at least once a year, so that we can stay on top of that. And if they see any changes, you all can start going ahead and talking about having those replaced. Your provider will look closely at your eyes, and then they'll assess the severity. And then they'll ask you about your vision, your medical history, and then what types of problems are you having with your vision, such as everyday tasks. So there's no way to cure cataracts except for to replace them. It's sort of like curing arthritis of the knee. How do we cure it? We really can't cure it. They can put some viscous solution in there, injections of steroids to try to treat the symptoms, but the arthritis is already there. That age-related deterioration in that knee is already there. So how do they completely fix it? Well, many of you have had a complete knee replacement. So you get a knee replacement when that joint is bad. Same thing with the lens. If the lens is if it has cataracts, then they're going to take that lens out and place a new one. So that's the only and best option that we have for cataracts. So during surgery, they remove the clouded lens, replace it with an intraocular lens that stays permanently in your eye. This is what I was talking about a few minutes ago. Another great benefit is that it corrects your refractive errors, so you usually rely less on contact lenses and glasses. I know many, maybe we will do a show of hands for this. How many of you have had cataract surgery, but you still wear some form of glasses, whether it be readers or, okay. And let's do a little poll. How many of you mostly wear them for reading? Okay. And how many of you who have had cataracts and wear glasses are wearing them for distance? So not as many. I notice not as many hands for distance, but more so for the reading, even after having cataract surgery. So your ophthalmologist or optometrist can talk to you about the possible risks of cataract surgery. They're very uncommon. For those of you who have had cataract surgery, how long did it take? What's that? A few minutes. Yeah, I think I went into the wrong business. When I did work in anesthesia, the cataract surgeries were usually done at the outpatient surgical center. It's not an inpatient procedure. And honestly, that surgeon oftentimes in the course of a day would do 25, 30 plus, usually upwards of 50 cases of cataract extractions in a day. Basically, that he would just go from one room to the next, to the next, to the next. I've never had it done, so I don't know the full process. I've never actually been in the room when it was being done, but it's a very quick procedure. Sure, there are side effects. There are potential complications from surgery. Probably one of the biggest things with any surgery is if you're taking a blood thinner, then they might need to give you guidance on taking your blood thinner. But it's a very common surgery, and it's very quick in and out. And it's a fact of life. So as I already mentioned, we're all getting older. None of us are getting younger. I don't know a single person who's getting younger. So we're all getting older, and we can expect to have those problems with vision changes or the need for cataract surgery eventually. So if I had to ask, if I had to do some research, I would say cataract surgery is probably the most common surgery of all. Lots of cases every day. Once you have it done, though, you don't usually have to go back and have additional surgery unless you've had a complication with it. And then how do we keep cataracts from getting worse? Well, regular eye exams are going to keep a watch on the cataracts. It's not necessarily going to keep them from getting any worse. I do tell patients keeping your blood sugar under control. So if you have diabetes, keeping that diabetes under good control can help protect that lens even longer. Stopping smoking. Smoking interferes with lots of processes in our body, and so if you're a smoker, smoking can increase the risk of cataracts, so avoiding smoking can help. Alcohol consumption. So if you reduce your alcohol consumption, that's going to be better. That might be holding off on the cataracts for some people. I don't really know the mechanism of action there. All I can relate it to is that our body is just going to work more appropriately when it's hydrated. And hydration is the opposite of alcohol. Alcohol is very dehydrating. And I may have mentioned this in one of my prior talks before, but I usually will mention it if I'm in the room with you. If you ever use rubbing alcohol, and we use it a lot down in the clinic, and we use it just in the medical field. If you spray alcohol on a surface and come back 30 seconds later, do you know what's happened to it? Most of it has evaporated. So it's very drying. Alcohol is very dehydrating to our bodies, to our kidneys, to our skin. And so our eyes are made up of fluid. We have fluid in our eyes that helps assist with our vision. A lens, if you've ever felt a cataract lens, if the doctor has ever shown you like a sample of one, they're very soft and very spongy, and they're very fluid-like. Contact lenses, just the ones that I'm putting on the outside of my eye, are also very liquid, very fluid-like. So drinking a lot of alcohol can dehydrate you, and that's going to contribute to dry eyes, lenses that are drying out, lenses that are becoming cloudy. It's not the only cause. I'm just saying it can contribute to it. Wearing sunglasses can help to protect your eyes. Again, also trying to keep them moist. So that's why I brought these beautiful, colorful plastic sunglasses for you guys. Again, those do have UVA and UVB protection, so they're just good just to have an extra pair. Maybe you keep one in your bag or in your rollator for when you do walk outside. Just protect your eyes. Eating a balanced diet. A little while ago, I talked about the importance of protein. So protein sources we usually think of meat, so beef, chicken, fish. There are beans and vegetables that are high in protein. And then, of course, protein supplements are very important. So that's going to be good for our overall muscle and muscle building, but it's also going to be helpful for building the proteins in those lenses. And then regular exercise and walking. Some of these suggestions kind of go along with nearly every medical problem, right? How many times do we say, eat healthy, exercise, I usually talk about protecting your skin, with sunscreen. Your eyes and wearing sunglasses are just as important. It's not skin, but it is an organ that you want to protect. Unfortunately, growing up, I had a next door neighbor who had spina bifida, and he was confined to a wheelchair. And he was just always so pleasant. We lived in a cul-de-sac, so he was always outdoors. He was older than I was, but he always wanted to watch us kids playing basketball or riding skateboards in the cul-de-sac. And unfortunately, he never wore sunglasses. Well, as a kid, I didn't think anything about it. But when he got to be about 35 years old, he was diagnosed with melanoma in the eye. And you couldn't help but think about the number of hours that he spent outdoors with unprotected vision, no glasses on. Plus, his family had a swimming pool, so he was often in the pool. He had a little lift that would put him into the pool and allow him to get back out. And you think about that light refracting off of the water probably contributed to his development of melanoma in the eye. So sunglasses are very important, and just as I said earlier, sunscreen. And then, I'm always talking about staying hydrated and avoiding things that dehydrate you. So even when it comes to an organ as small as our eyes, hydration and reducing alcohol consumption are important. So, and this is the part where I was talking about you can have cataracts removed at any stage. You don't have to wait until they're severe. Once they start to show that cloudy effect and your vision is changing, then you can go ahead and proceed with that. Usually waiting just interferes with your quality of life. More frustration, more struggles with not being able to see. I've never heard of this, but there's no need to wait until the cataract is ripe. I've never heard of waiting till a cataract is ripe. Fruit, yes, but not cataracts. But okay, I understand what they're saying. You don't have to wait till a certain degree of severity before it's removed. And then most people choose to have it removed when their vision and their daily life, their quality of life is being impacted by its effects. So prevention for the 3 of you who don't have cataracts, 6 of us, because there's 3 of us here who are employees who don't have cataracts yet. They're a typical part of aging. Steps you can take: don't smoke, use a magnifying glass to help you read, so therefore grab a magnifying glass on the way out. Protect your eyes from the sun with sunglasses, or any kind of eyeglasses. Many of you, your eyeglasses may have the transition, or I'm trying to think of the other name for it, when you go out in the sun and they turn dark. Transition. Okay. All right. I think there's maybe a brand name that they try to sell. What's that? Photo Bright. Okay. Photo Gray. Okay. So if you have those sunglasses, that's great. You're already wearing your glasses. You're walking outdoors. Your glasses change automatically. You don't have to take them off and put on a pair of sunglasses. But for those of you who don't have cataracts, wear your sunglasses. Wearing a hat with a large brim when you're outdoors, that can help also protect your eyes. And then, of course, as I mentioned, at least once a year, we should all be going and getting an eye exam and being checked by an optometrist or ophthalmologist. What questions do you all have? I know that was mostly cataract talk. Oh, so that's an interesting thing. I'm going to have to research that. I told someone, let me rephrase. I did tell someone before this talk, I said, I'm not an optometrist, I'm not an ophthalmologist, so I'm definitely not specialized in this area. She mentioned that in Europe, they don't do cataract extractions, but they put lutein in the eye. So many of you have been instructed to take like an eye vitamin, right? Arids 2 or something like that. But you're saying what you read is that taking it by mouth does not help. Someone's getting paid. Pharmaceutical company that makes those vitamins are getting paid. But so I'm going to have to do a little research about that. I had not heard that, Susie. Yeah. And then once you have surgery, you often have dry eye going forward and then have to use. How many of you who have had cataracts have to use eye drops for moisture? Okay. Well, I'd say at least half of you who said that you had had cataracts probably still need something for moisture. Again, I don't know if it's related. Dry eyes, I feel like, can be related to lots of things. Heat indoors. So if you keep your apartments too warm, that's going to dry out your eyes. It's going to dry out your skin. If you aren't staying hydrated, that's going to contribute to dry eyes. And of course, if you drink, alcohol, then that can contribute to dry eyes as well. So, but thank you for sharing that. Yes. Mm. Maybe I need to bring some visors to my next talk. Yeah, so if you all didn't hear what she said she finds these overhead fluorescent lights to be offensive. I work in the clinic. We have no natural light. There are no windows. From first time I get here in the morning till I leave at nighttime, I don't really see the light of day usually. But we work under these bright fluorescent lights. And you often notice, I've had a few people ask, when I come in the room, why do you have one of the lights off and one of the lights on? And it's for that reason. They're so bright. They're very damaging to our eyes. I think Cindy's going to make some adjustments here. Oh, yeah, you're dimming them. Maybe that's what I need in the clinic. I need a dimmer on my light switch. But yes, you're right. Those bright lights. I mean, it's fine when I go in a room and I need to look at a wound or look in someone's ear and I say, let's put a little extra light on the subject. So I'll turn the lights up. But they're also very hot. They're also very drying. So our exam rooms get very warm when we're sitting in a room with a patient doing a wellness visit for 45 minutes to an hour. It gets warm in there because these fluorescent lights are very, very bright. They produce a lot of heat. So, yes. Eye drops. My doctor put me on eye drops without preservatives in it. Mm-hmm. So the question is, she was placed on eye drops that have no preservatives in them, but many eye drops do have preservatives in them. So it's sort of like everything else. It's a jar of pickles. It's a jar of ketchup. Food, medications. Lots of medications have preservatives to help it have a longer shelf life and to help it survive longer and last longer, especially for some of those very expensive eye drops. I know many of you, they're very costly. And so, yes, many of them do have preservatives. But some people are allergic to preservatives. So depending on what your allergy list contains, you may not be able to tolerate a certain eye drop or a certain vitamin or medication that has, a component in it that you can't take. Yep, someone else had a question. Pat. Comment. Did insurance? Yeah. So she was saying that what I mentioned about you can get cataract surgery at any time goes against what insurance says. And unfortunately, yes, insurance is the thorn in my side and the thorn in every medical provider's side. I mean, they dictate so much as to whether I can get an x-ray or a CT scan, whether I can get a CT scan or an MRI. I often say the people making those decisions in those high-rise buildings with insurance companies aren't the ones who went to medical school, PA school, NP school. So they didn't do the medical training. They're looking at it solely from a financial standpoint. And sure, any surgery is expensive, but a surgery for your vision is very important. You know, it's one of our main senses. And so replacing that lens when you can't see is very important. And who's to be the judge of how bad your vision is? Only you. I mean, you're the only person who can really say, this is how bad it is, this is how much it impacts me. And so my guess is, just like everything else, we as providers have to jump through hoops to get things approved. I have to talk to insurance companies about getting a medication approved for someone, a medication that they've even maybe been on before or are on chronically. We have to do the legwork to get it approved so that you can continue to stay on it. And so we experience that, and so surgeons have the same thing. They may sometimes have to jump through those hoops or do what's called a peer-to-peer conversation with the insurance company to get it approved. Yeah, very frustrating. Yes? You know, I was younger. I was in high school when that happened, so I can't say for certain how they diagnosed it, but usually it's through an eye exam. So it's usually basically like a mole, and you can have moles in the eyes. You can have them deep in the eye, something that you can't see, but when they do the ophthalmoscope exam, they're taking a deeper look and magnifying what the eye looks like. If I'm not mistaken, his was even located on his optic nerve, and that's not something that you can see with the naked eye, so it's not something you would be able to pick up on, you know. Mm-hmm. No, I don't think there's any connection with a pterygium to melanoma. No, I think it truly comes down to the refractive nature and the light coming into the eye, how the body handles it. Just like if we get too much sun exposure on our skin, we can develop melanoma of the skin. Yeah. Yeah, I don't think that there's a direct correlation to that. I've not read of that. Mm-hmm. Yes, yes, they will be the person to ask, that's for sure. Yes, Mr. Lynch. Yes. Mm-hmm. And then they clear it up. So he mentioned, if you couldn't hear him, just a comment is that some people develop a fogginess behind the cataract within a year or so of having cataract surgery, and they have to go in with a laser and just clean that up. But once they do, it's gone. So, yeah, that's great. Anyone else? Yes. Um, None that I know of. You know, I am not an eye specialist, so I'm sure if I had one in the room, they may be able to say, well, 20% of people with dry eyes may develop this, or this. So I can't answer any specific question about whether that increases your risk of a certain eye problem. Have any of you been told that your dry eyes contributed to macular degeneration or glaucoma? Yeah, because glaucoma is a pressure issue. Glaucoma is where you have too much pressure in the eye, and so the drops that you use reduce the pressure. Dry eyes is a moisture problem. Sometimes that's the lacrimal ducts that aren't producing enough fluid. Like I mentioned, environmental factors, things like heat, really warm air can dry out. Certain medications that are drying can cause dry eyes. So I'm not certain about that, but that's a great question. Yeah. Anyone else? Comments or questions? You guys like this dim lighting? Ah, you got some feedback there, Cindy. All right. Well, thank you all for coming, and feel free to grab a pair of glasses or magnifying glass on your way out. Thank you.